Hello, everybody. Welcome to Mammal Heart Part 2. And so in this video, we're going to kind of talk about how the heart actually works, right? And what I want to introduce you to is the idea of the cardiac cycle, that the heart contracts and then it relaxes, and the heart contracts and then it relaxes. And it does this over and over again. This is known as the cardiac cycle, right? Now, when the heart contracts, right, and both the atria and the ventricles contract, but in the functioning of the heart, the contraction and relaxation of the ventricles is infinitely more important than the contraction and relaxation of the atria. The atria are relatively passive players in heart function. Now, I'm not trying to kind of blow them off too much or say that they're useless. They perform an important function. But people who have dysfunctional atria, like folks who have atrial fibrillation, where the atria are just kind of spasming, they're still able to live and survive and function. They're not running marathons or running up flights of stairs, but without the atria working properly, the heart can still sustain life. So I'm going to place our emphasis on the activity and function of the ventricles. So when the ventricles contract, the muscle squeezes down on those hollow chambers of the ventricles. And what happens is the volume of a chamber of the heart goes down during contraction. And if the volume goes down, as we've discussed previously, then the pressure inside that chamber of the heart is going to go up. Now, when the heart relaxes, and what this does is this ejects blood from the heart. This is what causes blood to squirt out of the heart into arteries. Right? Now, after contraction, the heart relaxes. And what happens is when the chambers of the heart relax, the volume of those chambers, such as the ventricle, goes up. So relaxing chambers expand. And as the volume goes up, what happens is the pressure inside them goes down, right? And this decrease in pressure causes the refilling of the heart. And so contraction and relaxation are equally important because you need contraction to push blood out of the heart and relaxation to refill the heart for the next contraction. Okay. Now, the reason that these pressure changes are important is that, like air, blood flows from areas of high pressure to areas of low pressure. Right? And so it's pressure differences that cause blood to flow. Pressure differences are caused by contraction and relaxation of the heart. So rather than depicting the heart kind of anatomically correctly, I have this simplified depiction of the heart where we have the veins that bring blood to the left and right atria, and the left and right atria function simultaneously, so we'll consider them together. Blood flows from the atria into the ventricles, and so this box represents the ventricles, and we'll consider those together since they contract at the same time. And then ventricles pump blood out into arteries, whether it's the pulmonary trunk or the aorta. And so we're going to look at those all at the same time. So what I'm going to start off with is I'm going to start off with the cardiac cycle, and I'm going to start at a place where, actually I need to look ahead at the next, okay. I'm going to start at a place where the ventricles are mostly full. Okay? And they are relaxed. And then the atria are relaxed. Okay? And so all chambers of the heart are relaxed right now. Okay? I'm going to draw in, I want to draw in these valves. Right? The AV valves, okay? The AV valves, the AV valves are open, and the semilunar valves are closed. That's our starting point. So what's going to happen first is the atria contract. When the atria contract, their volume, abbreviated by a V, goes down, causing the pressure inside them to go up. Right? When the pressure in the atria, so P atria, is greater than the pressure in the ventricles, right? Blood enters the ventricles. Now remember, the ventricles were already mostly full. So this blood that enters the ventricles, it's really only adding, depending on the resource you look at, 25 to 20% more blood into the ventricles. The ventricles are already about 75 or 80% full. We'll get to that point in a little bit. Now, the next step, right, is that the ventricles contract. When the ventricles contract, their volume begins to go, their volume begins to go, their volume begins to, their volume, their volume, their volume, their volume, when the ventricles begin to contract, their volume goes up. Oh, I'm sorry. My mistake. Their volume goes down. And that causes the pressure inside them to go up. When the pressure in the ventricles, right? So when the pressure in here is greater than the pressure in the atria, then the AV valves close. And so these AV valves will swing shut, right? Preventing blood from going back into the atria, right? And that's because the pressure in the ventricles is higher than the pressure in the atria. The closing of those valves actually causes a noise that's when you listen to a heart and it goes lup-dub, lup-dub, lup-dub. Well, the noise you hear is, one of the noises you hear is the closing of the AV valves. Now, the pressure in the ventricle will keep going up. And when the pressure in the ventricles, is greater than the pressure in the arteries, right? So see, now I have 3 arrows in the ventricle, but there's only 2 pressure arrows in the arteries. Then the semilunar valves open and blood exits the heart. Okay? And so the semilunar valves swing open and blood flows out. Okay? Everybody good? All right. So now let's take a look at what's going to happen next. So now we've had everything contract. So let's go back and look at let's go back and look at the next set of events. And I'm sorry that there was a bit of a technical problem earlier and I had to stop recording, but then things got saved to the file. Weird. So sorry. All right. So let's look at where we are right now. We have the ventricles are contracted, right? And they've ejected most of the blood. There's always a little bit of residual blood in there, right? Now, the atria, while the ventricles were contracting, the atria relaxed, right? The semilunar valves are open, and the AV valves are closed, right? And what we have is we have high pressure in the arteries, right? We have a little bit of pressure in the atria, right? I'll get to the ventricles in a minute, right? Now, what happens next is the ventricles relax. And as the ventricles relax, their volume goes up, which causes their pressure to go down. And so what happens is their pressure, which at one point would have been equal to the arteries, the pressure goes down a little bit. Once the pressure in the ventricle is less than pressure in the arteries, then what happens is blood wants to kind of come back in towards the lower pressure area, but that causes these semilunar valves to close. And that causes another heart sound, the lub-dub. So now we have two heart sounds. Now the ventricles continue to relax and their pressure continues to go down. So the pressure drops a little bit more and the pressure drops a little bit more. And then you can even think the pressure actually gets negative relative to the atria. And when the pressure in the ventricle is less than the pressure in the atria, then the AV valves of both sides of the heart open and blood from both atria fills both of the ventricles. And 75 to 80% full. And so the heart is filled, the ventricles fill by their own expansion, right? And now we're back to where we started. Okay? And those are kind of the details of how the heart works and how contraction and relaxation causes changes in pressure through changes in volume and drives blood through the heart. You can see it in these series of events where it's broken up into more steps, right? Something worth noting, and you can read a little bit more about this in the lab, is that before mammals are born, right? So if you have like a placental mammal that goes full term and is born relatively well developed, fetuses don't use their lungs. They get oxygen across the placenta from the mother's blood. And so in a fetus, the pulmonary circuit isn't functional. And so blood doesn't flow through the pulmonary circuit of a fetus. So in a fetal heart, there's an opening between the right atrium and the left atrium called the foramen ovale that allows blood to go directly from the right atrium into the left atrium. And then there's another thing, this blood vessel here known as the ductus arteriosus. And the ductus arteriosus is a blood vessel that connects the pulmonary trunk to the aorta, so that any blood that is pumped out of the fetal right ventricle doesn't go into the pulmonary arteries, but then goes directly into the aorta and directly into the systemic circuit. As soon as the fetus is born, muscles inside the ductus arteriosus contract, closing it up as long as everything worked right. And then the nature of this opening, the nature of the foramen ovale is such that as soon as blood starts going through the pulmonary circuit, that opening is squeezed shut and then kind of grows together in most cases. And so those are differences between fetal and adult circulation.